Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here to give you a little bit of your installment of your workforce safety and wellness discussion from your EMR program. So let's talk a bit. First, your patients, and your families can experience various degrees of stress and grief following a medical emergency, right? And it's only natural. We in public safety, we at EMS see some pretty extraordinary things. So it's natural to understand the idea that we're going to experience some stress and some grief as some of the things we see. To fulfill your duties as an EMR, you need to be in the best physical condition as well. So we need to manage our emotional conditions as well as our physical condition. You should have a complete physical exam, make sure that you're healthy enough to do the job. The emotional aspects of emergency medical care. You must learn how to avoid unnecessary stress and how to prevent your stress level from getting too high. We've got to successfully manage our stress, and there's a lot of ways we can do that. There's stressful calls we go on. We talked about this. Maybe patients who are like close family members, young patients, old patients, critical patients, and of course patients who have passed. We have a lot of unusual calls that we sometimes are brought out on. So it's important that we're clear on how to manage that stress, right? Unusual danger, violence, sight, smells, sounds, mass casualty events. We must make a conscious effort to prevent and reduce stress. Learn to identify those signs and symptoms of stress as a provider. Adjust your lifestyle to reduce stress as best as we possibly can, and learn which services and resources are available to help you through that stress. Normal reactions, 5 stages of reactions to death and dying, right? Denial. Should you see that stress relating to death and dying, right? Multiple reactions that we have emotionally that's important to be cognizant of. First, denial. The person experiencing the denial cannot believe what's happening. Anger. Anger's another level of reaction to stress, right? Anger's a normal reaction to stress and sometimes will be directed at you. Of course, bargaining. Patients and family members will have bargaining, trying to make a deal to postpone death and dying. Depression. Patients are usually silent and seem to retreat into their own world. And of course, acceptance. When patients understand that death and dying can't be changed, right? These are the reactions to death and dying from our patients most often. We've got to recognize those stresses, right? Some common stressors, things like irritability, difficulty with concentration, change in normal disposition, difficulty with sleeping or nightmares, anxiety, and decisiveness or guilt, right? It is important that we manage our stress as best we can. Some other warning signs, things like loss of appetite, loss of interest in sexual relations, loss of interest in work, isolation, feeling of hopelessness, alcohol, drug abuse, misuse, physical symptoms, right? We could have physical symptoms of physical manifestations of stress as well. How do we prevent stress? Biggest thing is going to be we got to eat healthy. We got to eat a reasonable, balanced diet to help prevent and reduce stress. Some examples of some really good foods to be eating, right? Grains, vegetables, fruits, milks, meats, and beans. We've got to have a little bit of all these things to be successful when it comes to our diet, right? Stress. We gotta drink water, right? We gotta avoid things like caffeine. We gotta avoid things like alcohol. We have to stay hydrated. So often, we have physical medical problems that can manifest when we don't deal with our own hydration. Other ways to prevent stress. Spend time with your friends and families. Develop hobbies or activities that aren't related to your job. Exercise regularly. Gosh, that's so important to have that regular bits of exercise. To meditate, have some religious activities, to get assistance from a mental health professional can help you manage that stress. And of course, reducing stress. You may benefit from the help of a mental health professional who's trained to listen in a non-judgmental way. Critical incident stress management is just a comprehensive stress management tool that's available through a lot of public safety departments. Workforce safety. You will encounter a wide variety of hazards and emergency scenes. It's important that you recognize those hazards and know which steps to take to minimize the risk they pose to our patients, our partners, and ourselves. Infectious disease transmission and standard precautions. Most common route of transmission, things like contact with infected blood, airborne droplets, as well as infectious agents. Those are common routes for transmission, and deeply important that we understand how those diseases can be acquired, because bloodborne pathogens is 100% a natural risk. This is a risk of the work that we do. So we need to have an idea as to how we acquire those diseases, right? Bloodborne pathogens, those are disease-causing agents that spread throughout the body after contact with infected blood. HIV is transmitted by contact with infected blood, semen, or vaginal secretions. We've got to wear gloves in order to avoid these risks, right? Also, Hep B, we forgot to talk about Hep B, but that's also spread by direct contact with infected blood, but it is far more contagious than HIV, right? Far easier to get hepatitis B. Hepatitis B actually survives for as long as 28 to 35 days after outside of a patient, right? It is just super virile and will just last a long period of time. We need to be mindful of it. Airborne pathogens. Tuberculosis. It's a super contagious disease that's spread by the droplets from the respiratory system. Wear a mask or a high-efficiency particulate air respirator and put an oxygen mask on the patient. You should have a skin test for TB every single year as an EMS provider, because you are within the high-risk clinical transmission pattern according to the Occupational Safety and Health Administration. Also, influenza, whooping cough, and severe acute respiratory syndrome, generally referred to as SARS, those are also expelled through airborne droplets, increasing the airborne pathogen risk. Direct contact, staph. All right, MRSA, multi-resistant Staphylococcus aureus. That is MRSA infections that are caused by the bacterium Staphylococcus aureus. MRSA is a huge issue inside healthcare facilities, hospitals, dialysis centers, nursing homes. These are things that commonly occur in people with weakened immune systems. MRSA is a pretty significant infection that you will find in places that you go as an emergency medical responder. Like we said, nursing homes, dialysis, hospitals, these are all places that we go with some frequency, so it's important that we're aware of those potential risks. Standard precautions: assume that all patients are potentially infected with with bloodborne pathogens. Always use protective equipment, right? We call this a standard or a universal precaution. Always wear appropriate gloves, change in between contact with each patient, and always wash your hands in between those glove changes. Also, wear a protective mask, eyewear, or a face shield when you anticipate blood. Standard precautions: once you're done with those gloves, wash your hands with soap and water. Make sure it's soap and water, not alcohol-based hand sanitizer. Don't recap, cut, or bend used needles. This is a very old practice, and it's important that we just simply place them into an available sharps container. We'll talk a little bit in your class about the proper removal of gloves, but let's talk instead about some of these important diseases and immunizations that are available for EMS providers. There are immunizations to the influenza, to tetanus, and to hepatitis B, and they're absolutely recommended for EMS providers. Check the status of your varicella, your measles, mumps, and rubella vaccines. That can be done through your primary physician. Also, TB testing may be recommended for any environment where you might come into contact with patients with TB. Responding to the scene. Safety is the most important when you are in EMR. It includes the safety of yourself as well as other people that are present at the scene. An injured or a dead EMR cannot help those in need. It's important that we drive safely, drive reasonably, and make sure we get there, arrive safe, and arrive alive. Dispatch. Use that dispatch information to anticipate hazards and determine how to approach the scene. Response. Fasten that seatbelt. Plan the best route. And make sure we drive quickly but safely to the scene. Park that vehicle. Make sure we park it in an area away from traffic hazards. Make sure that our emergency lights are operating correctly, and be careful when we're getting out of that vehicle. Parking our vehicle, wear-proof safety vests, right? These are important. These vests really give us an opportunity to have a lot of visibility when we're on a scene. Make sure we're wearing approved safety vests. And if your vehicle is not needed, make sure you're parking it out of the way of traffic. Don't put yourself in a position where your vehicle or you as a provider get hit when it's not necessary to be in that position. Scan the entire area carefully to determine what hazards are present and address them in the most appropriate order. Traffic. Make sure we control the flow of traffic on a busy highway. If you need assistance, call before you get out of your vehicle. Crime or violence. If you are trained in law enforcement procedures, make sure you follow local protocols. If you're not, proceed very carefully. And if you have doubts about the safety of a scene, make sure you wait at a safe distance and request help from law enforcement officials. If the scene involves a crime, avoid disturbing anything unless it's absolutely necessary. Crowds, assess the crowd's mood before you get into a position from which you cannot exit. Request help before the crowd is out of control. Electrical hazards, right? Make sure we don't approach scenes and keep everybody away from sources of a hazard whenever there's live electrical wires or any sort of live electrical hazard. Make sure the current has been turned off by a qualified person before you get close to the source, and wear a helmet with a chin strap and a face shield. If you are a trained firefighter, follow rescue and firefighting procedures. If you are not a trained firefighter, don't exceed the limits of your training. Don't go in burning buildings, and avoid things like without proper turnout, and avoid being in that position in the first place. Hazardous materials should be involved with placards. Having hazardous materials awareness is 100% an obligation of the program. Make sure you get that hazardous materials awareness training so you understand what a lot of these labels mean. If you believe a crash may involve hazardous materials, stop uphill and upwind and use binoculars to observe the scene. Odors and fumes may be the first indication. Call for assistance. Unstable objects like vehicles, trees, poles, buildings, cliffs, and piles of materials are the most important things to identify when you're arriving at a scene, right? Because if it's unstable, it could hurt you, and it's important that we stabilize it. Vehicles may need to be stabilized before patient extrication can begin. Undeployed any undeployed airbags are 100% hazardous to fire and EMS responders. Fire and explosions, of course, can result in unstable buildings. Sharp objects. Broken glass at the scene of a motor vehicle crash can create a hazard for providers as well. It's important that we wear those thicker leather gloves whenever we're in a scene where broken glass is a possibility. Make sure you wear those heavy leather gloves or firefighting gloves over your medical gloves to prevent injuries, right? Animals, they could be pets, they could be farm stock, they could be wild. They should be secured in the other part of the house away from the patient, right? It's important that we do so because they can really present a lot of other hazards to the patients or providers, including bites, kicking, or even trampling of providers. Environmental conditions. Dress appropriately for the expected weather. Be on alert for damage from high winds. Keep your patients dry and comfortable, and use emergency lighting when operating in the dark. Special rescue situations. Water rescue, ice rescue, confined space, or below-grade rescue. Terrorism and mass casualty incidents. Do not enter an emergency situation that is unsafe unless you have the proper training or equipment, right? It's important to not enter anything you're not prepared for. Quick summary. Stress is a normal part of the EMR's life, right? This is a normal part of what we do, right? There are a couple levels of stages of grief that you'll see from family members as it relates to that stress. Denial, anger, bargaining, depression, and acceptance. Be sure you're familiar with each section when it comes to the end of chapter exam. Stress management techniques include things like recognizing and preventing and reducing critical incident stress. You should understand how airborne and bloodborne diseases are spread and how standard and universal precautions can prevent the spread of an infection. And as you arrive on the scene of a collision or an illness, you must assess the scene for hazards including crime, traffic, crowds, unstable objects, sharp objects, electrical problems, fire, hazardous materials, animals, environmental conditions, special rescue, and of course infectious disease exposure. This has been a quick discussion in regards to the risks that are associated, workforce safety and health, the risks that are associated for your upcoming position as an emergency medical responder. We need to be aware of those risks and stabilize those risks whenever we're presented with them. Should you have any questions, reach out to your coordinator. I appreciate your time, patience, and energy, and we look forward to seeing you at our next lesson. Have a great day.